Do you love Indian spicy food but suffering from heartburn? Then you might be affected by GERD. Hello, I'm Dr. Harish Reddy, I'm a consultant medical gastroenterologist and hepatologist at Gastroexperts, Hyderabad. GERD means gastric esophageal reflux disease. It is a condition where your acid in your stomach or the food content in your stomach starts refluxing back into the esophagus, causing severe heartburn, chest pain and severe irritation. So GERD symptoms basically can be categorized into two. One is typical symptoms and other the atypical symptoms. Typical symptoms include chest burning sensation, reflux and regurgitation, whereas atypical symptoms include chest pain and severe chronic cough, and even some patients might complain of severe sinusitis and so on. So in the Indian cuisine, when we take it, there are a lot of potential triggers for GERD. So the main include severe spicy foods and other includes dark chocolates and excessive amount consumption of coffee, tea and the citrus foods and heavy fatty foods and deep fried items could cause can cause severe triggers for your GERD symptoms. So it is a very subjective thing. So all patients do not suffer from GERD on consuming spicy foods. So it is very individualized. The patients, based upon their underlying cause for the GERD, the spicy food reflexing back into the esophagus could trigger severe GERD symptoms. It doesn't mean that all persons having spicy food suffer from GERD. So GERD management comes into various stepwise process. So in that one, the basic thing is the lifestyle changes. So the basic lifestyle changes include consuming very small amount of meals, consuming it in multiple times over a day, and even avoiding fatty foods and decreasing the amount of coffee and tea. Along with that one, decreasing consumption of dark chocolates. And coming to the timing of the meal is one of the major thing which has to be maintained, and at least there should be a 3 hours gap between the evening meal and the bedtime, and during the sleep always the head should be in an elevated position. So coming to the medical management, it is always advisable to consult your doctor before going ahead with an over-the-counter medication. So in patients with typical GERD symptoms, when in spite of doing all the lifestyle changes with weight loss programs and everything, in spite of having persistent symptoms and severe symptoms and the complication related to GERD, and it is a time that you meet your gastroenterologist. So patients suffering from GERD who are having severe persistent symptoms like severe chest pain, chest burning sensation, regurgitation and other complications related to GERD, including dysphagia or any blood vomitings, it is always advisable to consult your doctor. In conclusion, GERD is a common digestive issue, but there are ways to manage it. So enjoy your favorite Indian food. Remember, a healthy lifestyle and dietary adjustment and a proper medication use can make a huge difference. So if you have concerns, so consult a gastroenterologist to develop a personalized plan for your gut health. Follow us on Facebook, Instagram and YouTube for interesting content on your gut health.